I am Dr. Maxwell Santi, consultant gastroenterologist. Have been working at Chelsea Park Hospital in the Sloan for the past 26 years, and I specialize in bowel and digestive issues. Bloating essentially is a distension of the abdomen. There are many different structures in the abdomen, including the bowel, small intestine, stomach, kidney, ovary, uterus, depending if you are a female. And any swelling or distension of these, because the abdomen is a closed space, can result in a feeling of bloatedness. Although in the vast majority of people, bloating is excess gas in the colon, and that simple maneuvers can resolve it. Because bloating can result from a distension of any organ in the abdomen, it can be serious. For example, if the ovary was to become enlarged, because it's a swelling of a structure in the closed abdominal space, then people can feel bloated, and that could be something serious. The key is that if you are bloated, depending on what symptoms that are going with it, that is what may make you feel, a clinician become aware of the possibility of something more serious driving it. It really depends on what's causing the bloating. So for the majority of people, bloating can coexist with things like a sluggish bowel, constipation, maybe eating foods that doesn't agree with them. Then in those sort of situations, modify, for example, your fluid intake, physical activity to improve your colon function, say, may be quite helpful. For those who are finding that they are intolerant to things like, say, lactose, they may find that they may need to cut that down. Sometimes people who are sensitive to things like, say, onions, applying the low FODMAP diet can be beneficial. But essentially, the key is that if these symptoms are persistent and are accompanied by other worrying symptoms, then it's really addressing and finding out what has caused the bloating is how you stop it. You definitely need to seek medical advice with bloating if it is very severe, whether it's accompanied by abdominal pain, whether it's accompanied by weight loss, and then any organ-specific symptoms that are unusual for you, prolonged period bleed, severe lower abdominal pain, all of that could signify that the underlying organ is not functioning well and therefore needs to be evaluated. But I think in summary, I'll be saying that essentially, if you have bloating to this degree, your best approach is when you seek medical help that people should be listening to the description of your symptoms as the key director as to what may be driving your bloating, rather than a knee-jerk reaction to test to begin with.